And now we address other topics. Although very limited, tourism activities in certain areas of Cuba continue. In the first 5 months of this year, the island received only 9% of visitors as compared to the same period in 2020 due to the COVID-19 pandemic. We have more details in the following report from the central province of Ciego de Avila by our correspondent, Lisandra Andres.
35 kilometers of rocky road separate the Moron municipality in Ciego de Avila from the tourist resort of Cayo Coco, one of the most important in Cuba. Foreign visitors from Russia and Canada arrive here weekly, from their arrival at the Máximo Gómez airport to the welcome, and their hotels' strict security protocols are enforced to prevent the spread of COVID-19.
My friends and I are 30 people who come here often. A few of us come 4 or 5 times a year, so something attracts us. First of all, the staff, all the measures they take to keep the staff safe. The management does an exceptional job to make the employees feel good and safe, and everything is perfect.
The hotel facilities in Cayo Coco are made safe for visitors and sector workers. At the Pullman Hotel, for example, they work at 20% capacity, but without ignoring health measures.
The resort is especially safe given the geographic conditions and the strict protocols the Cuban government has implemented to make sure that the travelers who put their trust in us can leave after enjoying a fabulous vacation free of any contagion. Having a PCR result in a very short time guarantees us prompt isolation of any person who may be sick, and therefore allows us to curb the transmission or transmissibility of the disease within our facilities, which means we provide a more wealthy tourism, safer, with more guarantees for the tourist who is arriving in the country.
For almost a year, the Hotel Sol Cayo Coco has been operating as a hospital for the treatment of patients confirmed with COVID-19 and travelers arriving from abroad, a measure that prevents the contact between tourists and residents of Moron municipality.
All the workers we have in the red zone in the monitoring area are equipped with all protective means, both health workers and hotel workers who have been with us from the first day. And of course they have been trained, and if any personnel who have not worked here before arrive, of course we explain to them the measures to be followed, both by the personnel who are in charge of the hospital and the team leader who's in the red zone.
We are making sure that the tourism system is kept active, because we know how important it is for the country. We are doing our part. We also have people working voluntarily in the hospitals, and that is what we have to do. It is a great task we face now.
The Ciego de Avila Keys are the 4th largest of the Cuban archipelago. The development of tourism in this region is an important source of hard currency income for the country and of employment for the residents of the province. And in times of the COVID-19 pandemic, nobody here has let their guard down in the implementation of health protocols to avoid infection.
Lisandra Andres, Telesur, Ciego de Avila, Cuba.